Okay, thank you very much. So welcome to the ERA workshop. As you might know, the topic of this year's workshop is radon risk communication revisited. And we will have some interesting talks, and later on we will also have our World Cafe as usual. So it will be recorded and it will be online. So you know that. So it's already started. We're online now. Jose, thank you. You're checking. Great. So the first speaker is Katarina Antunes. It's correct. Yeah. And the title is the Radon project, an example of how citizen science project can increase radon monitoring and promote remediation.
I wanted to share the screen with to share the screen with
Yes, yes. They might try to add in normal Zoom meeting.
Okay.
First to like this. So presentation mode.
Let's just
Okay.
look at that.
No.
Is it okay if I stand? Should I say? Can you check if it is?
Stay near the mic. Near the mic.
Okay. Okay. So good morning. Let me just start to thank to ERA for this kind of invitation. It's not working, sorry. So the presentation, it will be about the Radar project, that is a citizen science project under the framework of Radon Citizen Science Call. But not working
It's like yesterday.
It's like no.
Okay. So, but taking in the theme of this workshop, I will start for visiting the radon risk communication that we have in Portugal since the 80s or 90s from the last century. So, and then I will move to the radar project. So, in Portugal, since the 80s and the 90s, we have some different type of materials that have been done for the authority in that time. Now we are the competent authority for this matter, but we have previous ones doing this work. So we have a lot of materials that were done. Mostly showing that radon is a very bad thing. So we have a previous map also that is it was made only with concentration. Now we have a susceptibility map, and this leads to some myths that need to be deconstructed, because in Portugal we always use the message that only granite houses has radon problems. So we know that is not true, but this remains an issue in Portugal. So, and also that open windows, it will solve the problem. It's not true, we know that, but we need to deconstruct these myths, because they conduct to people who know nothing about radon. So, and the other problem is that we have different information available, because we have an old map only with concentrations, but we have a new one that is very different but sometimes I can give you an example that remediation companies still have the whole map in their website. So it's not easy to go through these things, and different reference levels, because until 2028 we have 400 becquerel per cubic meter reference level only in the part of the country. Now we cover all part of the country with 300 becquerel per cubic meter. So this leads to what? An important part of the Radon action plan in Portugal, that we dedicate almost 1/3 of the actions to communication, because we understand that is a very important thing to go through this reducing exposure to radon. So how are we doing the communication in Portugal? So we are trying to go to the very common communication strategy, because we are trying to assess the perceptions of the level of knowledge in Portugal. So it is being done with the survey from Radon. We are now analyzing the data to see how it will be the best approach to go and tell people what to do with. But for now, we are trying to use language that for us it seems to be adequate and needed for the people that is receiving the message. So for that we are doing passive methods, such as I will show you after what we have done until now. And we are trying to maintain also open dialogue, because the active methods, you know, that we have to use also. So this is some of the passive methods that we have. We have flyers for the national survey that we did in 2020. We have other things like the poster about the radar map, about the fund that we had last year to do remediation, and these are one of the examples. We also have a web page. We are now we tried in Portugal to disseminate the web page as from the web page with it's a trust source of information, because it's from the competent authority in this matter. We provide a lot of information that can be used for other. I'll give you an example. This one is in the middle is the information that we prepared, and the employers can use to present to their workers from the moment that they are monitoring their workplaces. And very important, the active methods. We have an email that is dedicated to Radon. We have a helpline. We receive a lot of questions there, and we are noticing that the knowledge about Radon is increasing, because we are having more calls and emails about this. We do a lot of, we think that we do a lot, but I think we are working on that. We do a lot of events for public, for stakeholders and construction professionals. And finally, the thing that I will talk in more detail is the citizen science project that we had in a part of the country. And it shows that is a good way to go to reach people and try to change perceptions and promote behavior change and people their houses. Sorry. So the citizen science project that we had is called Radon. The students were the key players on radon management. This is a radon project, as I said in the beginning. Here we set some of the objectives that we set were to increase awareness about radon, try to have radon measurements in the region that was poorly characterized during the national survey, and of course promote remediation with the behavior change of the community. The expected outcomes were to do 300 radon monitoring, to create communication and dissemination materials about radon that suitable for that community, increase radon knowledge, at least the high school students that were the direct engaged that were the citizen scientists, and at the end to create some guidelines about strategies that can be used in Portugal for local awareness campaigns. So the area of implementation was in the inland part of the country, the district of Porto Alegre. As I said, it was a poorly characterized region in terms of radon measurements with the national survey. So we contacted 3 schools here, 2 from the municipality of Porto Alegre and 1 from the municipality of Antunes. And this project was done by a consortium between the Institute Superior Técnico and my institution, the Portuguese Environment Agency. So, as I said, citizen scientists were high school students. The intention here was to the high school students creating and implementing local communication strategy. The objective was to inform population about radon risks and how can we reduce exposure, and very important to pursue the measurement of dwellings in their community. So the timeline. The project was a 9-month project. We started at the beginning of the school year in September from last year. We started with the presentation of the project to the students. After they start working on the definition of what they are expecting to deliver the monitors, the detectors, sorry. They were working on the dissemination materials and scheduling the events for community for the distribution of detectors. After the 3 months of measurements in the dwellings, the students started to retrieve the detectors, and the detectors were analyzed in the laboratory. And during April, we delivered the results to the students to be analyzed for them. We intended that it was important to involve students in all the process. So it was very interesting to see what they did with the results, because involved maths, involved the different type of disciplines that they have in school. So in May, we resumed the project. They presented the results to the community, and we had a final event in Lisbon. So the starting point, as I said, it was in September from last year. We went to schools, we presented the project, we said to them what was expected from the schools. They were very into it, so they were from the first moment very engaged with this. So we went to the street school, we engaged with more than 20 students in each school, and we were also teachers that were responsible for the project. So the key points that we consider that were the key points for this project was the engagement strategy that we had with the students. We set a gamification process to them, because we understand that create competition between schools for awards. It was a very good idea, because from the very beginning they were very into it because they want to win to the other school. So, and we have the opportunity to give them a final event that was held in Lisbon, and they have the opportunity to visit the research laboratories from the Institute Superior Technique and make presentations in the Knowledge Pavilion. It was very, and the awards were distributed there, so it was a very good day, and they were very happy to participate. So, as communication strategy, we set this in 3 levels: local, national, and international. For local community, for local communication, most of this communication were done by the students and the schools. They made several things to engage with their community. National communication, we have in our webpage a dedicated page to this project, and we have the opportunity to deliver some information also in the website of Ciência Viva. That is a platform that helps, tries to link community with science. And with that, we managed to have a workshop for teachers from all of the country. We deliver 2 half-day sessions about Radon. They were very interested. And I think if you want to get to their schools and to start some kind of these projects, probably they were willing to participate in this because they were very, so it is a thing that they don't know it, but now we know it, so probably it will be a good way to go after this project. As international communication, we had participated in several international conferences. We have our information also in the Radon website, so I think the project has been his visibility also in an international level. So here are some examples of the local communication that the students did. They went to social network from schools. They created a dedicated Instagram page to their projects. They published some news in school newspapers. They create dissemination materials. And very important, they also deliver sessions to other students. So in all schools, the students that were working on this deliver sessions for their colleagues from other classes. And one of the schools also did sessions for other people in the center communities in their village. So I have here some pictures also from the public sessions that we had to deliver the detectors to the volunteers, and also the final sessions that we have after at the end of the project. Continue with local communication. So it was very easy to students and to schools to engage with the local newspapers. So they managed to publish 4 different articles during the project lifetime. And what were the results? So we had 3 main objectives. One was to increase awareness about Radon, and for that we with the public sessions, with the engagement in schools, we reached at least 365 people, and here we are not taking in consideration people who read the newspapers, who saw the social media accounts, and so this are only people who attended the public sessions and the students and teachers directly involved in the project. About promoting radon testing, so we at the end, from the 300 detectors that we delivered, we had 261 radon measurements that were okay. So here we are talking about a recovery rate of 87%. In national survey, we had a recovery rate of 68%. So I think it was a success, this part of the project. So we managed to increase the radon testing with the project. About remediation, so we are at the beginning because we had public sessions to explain to volunteers what they should do about remediation. But now we are trying to promote some engagement between citizens and remediation experts to see if they really start to do something, because in some cases we have very high levels of radon, so we feel that is the way to go and try to promote this engagement to pursue the remediation in that houses. So to conclude, can citizen science contribute to behavior change? So that we cannot answer because we are in halfway to do that, but I think that what Tanya showed from the 2 days that we are staying here, yeah, the citizen science has this promising that can promote radon monitoring and remediation. So we hopefully are going in the right way. And I think it's my last slide. So what we intend to do in the future. As I said, from this project, we intend to promote engagement between the citizens that need to remediate their houses and remediation experts to see if we can, for sure, promote behavior change. And we understand that this project was very successful in Portugal, so our intention is to do this in other schools, in other parts of the country, and continue this work in Portugal. So let me just thank you for your attention, and I hope you enjoyed it.
Thank you very much. And we do like this as we save the questions for the audience.
Okay.
All of you. Okay. Once more, thank you. Next speaker, the radon busters across Europe, theory-based, evidence-based, and strategic radon risk communication. Sofie, Apers, yes. You need some help with that.
Okay, we will take questions after.
And we have the Q&A. Right.
Yeah. Speak.
Yes. Hi everyone. I have a first question. As health authority in your country, would you use humor to communicate about one of the leading causes of lung cancer? My name is Sofie Apers. I'm a fourth year PhD student at the University of Antwerp, and today I'm here to convince you that we still need theory-based, evidence-based, and strategic radon risk communication. But first things first, we started with an empty notebook. We went back to the drawing table and looked at the context in which this research would take place. And that led us to two main research questions. First, what does the current radon communication look like? And second, what do people in radon priority areas actually think of this radon communication? For the first question, we did a systematic review where we evaluated radon mass media campaigns. We scanned over 1,700 papers. We ended up with 40 papers included, of which they reported 27 campaigns. And we found that most of the campaigns focused on raising awareness, raising knowledge, and raising risk perception, all with the ultimate intention of changing behavior, but really awareness, knowledge, and risk perception was the focus of the interventions. They wanted to do this with brochures, with all the information at once, all the technical information and very general technical, talking about becquerels per cubic meter, radon risk areas, all technical things. And we found that it actually resulted in very limited increases in awareness and also very limited increases in testing behavior. Second, we wanted to look at what do people in radon priority areas think of radon communication. So we switched a bit, but we did design thinking workshops where we went to people in Belgium and Slovenia in radon risk areas and really went to them to the table and discussed with them what they thought about current radon communication and what they perceived as the future of radon communication. These were really involved discussions with the help of a company that was specialized in these design thinking workshops. And for the current communication, we saw that people think there's a lack of policy in general, lack of regulation, unified strategies across Europe. For instance, we had people from the country Luxembourg who were very close to the border with Belgium, but they could not find help in Belgium because of they had to stick to their country in Luxembourg. Also, a lack of help all over, economic help, support in different ways, but also a lack of communication. When they looked at future radon communication, they really focused on two things, a need for stepwise communication. First of all, they wanted to be engaged with the issue. They wanted to propose, for instance, catchy radio spots or personalized letter and comprehensive website that was easy for them to understand. And then this engagement would lead them to testing, and then in their opinion, and then when they found high levels, then they wanted really personalized advice because they thought, yeah, now I have these high radon levels, what now? Then they have all this general information, but they actually want someone who tells them what to do, what to buy, where to buy it, and so on. And they proposed that it could be with testimonials. They said, we want to hear the success stories, but we also want to hear the stories that might have failed so that we can learn from it and then we can take it into consideration. And they want personal advice. So to conclude these two studies, we found that the current communication focuses on awareness, risk perception, and knowledge with very general and technical information. But people actually want stepwise communication with very personal and relevant communication that's engaging. With a side note that awareness is actually not an objective, but a precondition to behave. You have to be aware to follow behavior, but ultimately behavior is the objective. So back to the drawing table, we have all these insights now. What do we do now? So what do we want for this intervention? We wanted personally relevant communication. We wanted more engagement in radon priority areas, and we wanted the right information at the right time. For personally relevant communication, we set up an online experiment where we compared statistical versus narrative texts. Statistical texts are based on the risk as analysis, so risk perception as something very technical, likelihoods, numbers, facts, and so on, with very general information and building on the rational approach so that you provide information, people will act. But narrative texts focus on risk as a feeling. So does this apply to me? How do I feel about this risk? And narrative texts often make use of testimonials, and they are known to increase personal relevance. We compared two texts, two news articles that were actually in the Belgian media. I remember one of the first meetings in my PhD was with the Federal Agency of Nuclear Control, where they told us about these articles from Metro, but also about one article from that was not related to their communication, with about a young mother who was diagnosed with lung cancer, and radon was actually mentioned once in the entire article, but they said that it could have led to an increase in radon testing. So we thought, well, why not test them? So we matched them both in content and in length, because they were quite different. And we found that some interesting findings. So first of all, we went to look at risk perception specifically and focus on personal risk perception compared to general risk perception. So personal risk perception is more focused on how do you feel about this? Does it apply to you? Do you think it's relevant for you? And general risk perception more on the broader picture of the risk. And we saw that both risk perceptions were significantly higher in the narrative condition than in the control condition. So already a good sign for the narratives. Then we looked at intention to test, intention to seek information, and intention to mitigate. Intention to test, we saw the same. For narrative text, intention to test was significantly higher compared to the control condition. For intention to seek information, we saw that narrative texts were significantly higher for both control condition and statistical condition. And for intention to mitigate, we found that the narrative texts were also significantly higher than the statistical texts. This is just to show that we can broaden communication from general communication to also employ more emotionally driven communication. So, what we want personally relevant communication, and we have shown that this actually can work to increase intention. We also want more engagement in radon priority areas. For engagement, we have to grab the attention first, and then we hope it's motivation. To grab the attention, we can use different strategies. Narratives, for instance, is also a strategy that's used to attract attention and also to enhance the comprehension of communication, of risks, specifically cancer-related risks, and can also increase the recall of the information. Humor is also a strategy that's used to grab the attention, to improve the acceptance of the message, and that evokes positive emotions instead of fear or high-risk perceptions. And then increasing also norm nudges is a strategy that can grab the attention and is built on social expectations, because when we first looked into the determinants of behavior, we saw that really norms, descriptive norms, subjective norms were really important in actually convincing people to test. So, okay, that's good to know, but we will use this in a moment. And then the right information at the right time. Before people can actually process information centrally, we need attention, motivation, and ability to process this information. So people have to be attentive to the information, they have to be motivated to process it, and they have to be able to process it. Only then information will be processed on the central route, and only then attitudes will change on the long term. Okay, all good and well, but what now? We built a radon radon buster campaign in collaboration with the health risk communication and behavioral specialists, so the team of University of Antwerp and Belgium Research Center. We collaborated with local stakeholders in different countries, the authorities, and we collaborated with a marketing agency that could really translate our academic findings to a campaign. We had a really close collaboration, so it would be a ping pong almost of making sure that everybody understood each other and then we communicated as in a sensitive way. And then we came up with the Radon Buster campaign. This is the Radon Buster, built on the idea that everybody can become a Radon Buster. The campaign was built as follows. So we wanted to create Facebook posts built on the humor, the narratives, and the norms. They would then lead people to a centralized website that was easy to understand. And on this website, people could find information already, but then also guided to local web pages where they could find more information specific to their regions, radon maps, and also could order radon tests. We tested it in 2 phases. So we first did an experiment to test the information seeking intention, and then we also looked broader. So these are the posts. I will give you a minute to read them. So this is the humorous one. It's built on these premise of looking for excuses. We have also the narrative one. This one tells a story about a house that is sad because it's contaminated with radon, and it wants to be a happy house, but then the owner helps the house by testing the house, and then the house becomes happy again. And then we also have the norms, which really focuses on can you see the uninvited guests in the picture, and also on some determinants. For instance, this one focuses on knowledge, although she already has a lot on her mind, so making it relatable to other people. So these were the posts. We first did an online experiment in Austria, Belgium, Ireland, and Slovenia, where we tested these materials in 4 conditions. So we have the humor condition, the narratives, the norms, and the control condition. And we looked at the motivation by seeing to what extent people found the communication materials personal, relevant, easy to understand, and interesting. And we found that in Austria, the norms condition was significantly, the motivation was higher in the norms condition, in Belgium in the norms condition, narrative and humor, and in Ireland in the humor condition. In Slovenia, we did not find significant differences. And then we looked at the relationship between motivation and invitation to test as a direct relationship, but also immediate and through invitation to seek information. So for the mediation, we saw that motivation actually led to intention to test through intention to seek information. We also found that there was a direct effect of motivation to intention to test, so the total effects were very significant in all the countries. So the first experiment was successful. Then we went to the second experiment, where we also implemented the website, and we went live with the website. You could actually look it up, not anymore, but during the period of the pandemic. So we had a social media study of 4 weeks on Facebook and on the website, where in Austria, Belgium, and in Slovenia, where we posted these posts and actually with an advertising budget, which I will show you later on, looked at the engagement and the click-through rate. So for motivation, we looked at the engagement rate, which means everybody who had been reached with this publication is a reach, and engagement is everybody who clicked on it, liked it, shared it, posted comments relative to this reach. And then for seeking information, we looked at the click-through rate. So everybody who clicked on those Facebook posts to look to the website. And we saw in Austria, we spent 1,000 euros on advertising budgets. We reached over 70,000 people with an engagement rate of 3.8% and a click-through rate of 0.74%. Now, to give you an idea of what these numbers mean, an engagement rate between 1% and 5% is actually really good, and a click-through rate between 0.7 and 1 is also really good. Bear in mind that this was a new campaign. Nobody knew Radon Busters to begin with, so we started from scratch, and we already got these high numbers. In Belgium, we spent 1,700 euros, and we reached over 170,000 people with an engagement rate of 3.4 and a click-through rate of 0.87. In Ireland, we spent 1,300 euros with a reach of over 113,000 people, engagement rate of 3.8, and a click-through rate of almost 0.9. And in Slovenia, we spent 500 euros. We reached 47,000 people. We had an engagement of almost 3.9 and a click-through rate of 0.9, which were actually really high numbers for such a new campaign. So what do we want? We want personally relevant communication. Sorry, it's switched, but I will tell you. So we did find that personally relevant communication can increase motivation to seek information. We also want more engagement in radon priority areas. We do found that engagement is indeed a precondition of behavior, and we want the right information at the right time. So we have to have communication targeted to the behavioral stage. But that's not all. This is just a puzzle, just one small piece of the puzzle of what we actually want. We want communication is theory-based, evidence-based, and strategic. That's built with communication experts, but it's also a holistic communication strategy. During the workshops, we often got the comments that communication about radon should be as communication about COVID, where everybody was communicating the same message with different channels, different types of communication, very broad. But that's not all. We also want policy. We want economic support. We want social support. Things like family doctors who are communicating the same thing, but also citizen science project. I think that can really build on this community. We also want available testing contractors. And we want, of course, close collaboration between different stakeholders. So that was me, my PhD in a nutshell. If you have any questions, I will hear it afterwards, I think.
Yes.
Yeah. Thank you.
Thank you very much. And as we said, we saved the questions for after the four presentations. And who say the questions online, please save them to save the questions online to later also.
Yeah.
Or the possibility, could they send in questions? Yeah, thank you. So, next speaker is Laura Mezquita, Radon and Health, how physicians approach communication. Thank you. Welcome.
Well, thank you very much. Good morning, everyone. First of all, I'm really thankful for the invitation to participate. So it's my first face-to-face workshop, because I was participating in another one during the COVID-19 crisis. It was not exactly the same thing. So the idea is to talk a little bit, because there is not a lot of evidence about this, and it's mainly all the lessons learned after all these years working on radon with patients. So So this will be okay. So this will be the outline of the presentation. So the idea is start with which is the context of the patients with cancer and the communication with them. Some experience about how to approach the radon communication in patients with lung cancer and families, and some considerations on the future and the homeless. So this is our context. So I'm a medical oncologist working on thoracic oncology. So the majority of my patients, 90% of the patients have lung cancer is the first cause of cancer death. So it's, when we talk about the prognosis of the patients, we use the outcome 5-year survival rate, which is not really nice because it's just 5 years. And we say there is an increase in the prognosis of these patients, thanks to all the treatment and new opportunities for the patients. But if you see, the curve is not very high, and still the overall rate, so all the patients in the same box, the 5-year survival rate is still 25% of the cases. And do you know which is the 5-year survival rate for breast cancer? More or less? 90%. And for colorectal cancer, which is the main tumors, is more than 70%. So these are the three most common tumors, and lung cancer is this prognosis is really poor because the majority of the cases with lung cancer are still diagnosed in advanced disease. So this is 80% of the cases. In Spain, there are reports even of 60% of the cases. And the difference is, do you know what is the difference? Why are this difference between lung cancer and breast cancer or colorectal screening? Also, the aggressivity of the disease is more aggressive lung cancer. But in the other tumors, we have the screening programs, so for breast cancer, colorectal cancer, and we have the evidence of lung cancer screening, and it's implemented in other countries, for example, in the US, but not in Europe. And this is the situation. When there are countries with implementation of lung cancer screening, we change this proportion of cases. And there are more curable cancers with more early stages, and we can change this proportion. But for now, this is still like this. So smoking is the most important risk factor. So it's related to more than 80% of the cases. Related not only with one carcinogen, more than 50 carcinogens associated with one smoke. And this is strong, there is a strong correlation between the smoking and the lung cancer incidence, lung cancer mortality, and overall outcomes. So this is the result of we have preventive strategies in health focus exclusively in smoking. And so all the strategies in prevention in health, in the health departments or in the health minister are focused on quit smoking and the low CT scan, which is the lung cancer screening, but only for heavy smokers. So we have no preventive strategies or even information for other risk factors. And indeed, lung cancer is a multifactorial disease. So there are more than 30 carcinogens considered group 1. So it's shown that induce lung cancer in humans. So here you can see some of them. It's not a detailed list. But in our medical environment, we have a misperception. So there is a stigma associated with smoking. Because what is the first question that everyone asks to a patient with lung cancer? So they do smoke, and then there is this, you're thinking about the probability or if it's, it's fair or not to have lung cancer. So indeed, the stigma associated with that minimize the impact of the other risk factors. So obviously, smoking is the most important risk factor. So this is true, but there are up to 20% of the cases that are non-smokers. And there are other factors without being smokers, but also were exposed to other factors, additional factors right now. And the majority of these cofactors co-exposure are synergistic, so can increase the risk of developing cancer, and it's not only smoking. And additionally, we have this issue. So the communication process in lung cancer at diagnosis is not easy. It's very complex. So imagine in our first consultation, so the first visit in medical oncology is depending on the hospital, 45 minutes or 1 hour, which it seems a lot, but we need to discuss what are the patterns. Because sometimes there are other specialists that believe, no, the oncologist will explain all the things, and the patients came with to the consultation with no information, so we need to explain what they have, or the therapeutic options, if it's needed to perform additional studies, risk and benefits of the treatment, follow-up, organization of the treatment in the hospital, psychological support, nutritional support, social support, empower the patient to explain all the resources that we have in the hospital, all these kind of things. So sometimes the expected outcomes, which is probably the most difficult discussion with the patient. And all of this is in the first consultation. So the the doctors that are starting to know about radon ask me all the time, are you sure that is the best moment, the first consultation to talk about radon? And yes, let me explain later. But the situation in our medical environment is this. So we study radon, so there is not reported, and it is not reported doesn't exist. So this is the situation. There is a lack of knowledge, there is a lack of awareness, there is no impact on cancer prevention right now in our medical environment for the patients and for the doctor's situation. So how to approach radon communication in this context? So I will explain some experience that we have, but I'm quite uncommon profile because I'm a medical oncologist working 50% of my time in thoracic oncology, and I visit patients with lung cancer. Around 50% of my time on the clinician side as I'm a researcher in the labs, and this group with different people working mainly in radon and in other carcinomas. But indeed, I've been working on radon thanks to a patient, because in 2011, so long time ago, I met Billy, who was a patient with 42 years old, so young patient, non-smoker, female, with a lung adenocarcinoma. She was living in a radon-prone area, and she was the first person that told me about radon. And after this moment, I started being interested on reading about radon, but it was just the curiosity to know that there is a risk factor and there is a gas and disease, and you can have accumulation of radon in your, and I'm from Zamora, which is a small city here, and I did my studies in Salamanca. It's radon-prone areas in the west of Castile y León, but I was surprised. So the thing is that years later, in 2014, I had the opportunity to do my PhD on lung cancer in non-smokers with an open subject. And I decided, why not, to explore radon and the molecular profile in a small quarter of patients in Mali. So I did my PhD about this, then I moved to Paris, and I did my postdoc there in collaboration. It was in Gustave Roussy, an international center of cancer, but that was in collaboration with the French Atomic Energy Commission and the IRSN. And since 2020, so I come back to Spain in COVID-19, at the beginning in March 2020, is one of my main line of research. So in MECA, we are running now these two large cohorts. There's the mirror, thanks to a fish and national grant in Spain, and my radon, thanks to Radon Consortium. So there are more than almost 2,000 patients enrolled with lung cancer. With different design, is more focused on the molecular and immunoprofiling of lung cancer associated with radon. And the thing that is interesting is in all these studies, we collect information with a questionnaire for the patient. So it's a very long questionnaire with 23 pages. But they are our patients. So we see the patient every week. So the first week is like, do you have the questionnaire? No. Next week, do you have the questionnaire? Do you need information? Do you need help to collect the questionnaire? And at the end, we have all this information. So we have a very strong relationship with our patients. So this is just a preliminary information because bioradon is still enrolling. So mirror was closed at the end of September, so last week. And mirror, we have this preliminary report of 2,200 patients with lung cancer. And at the beginning of this questionnaire, we included a few questions just to know, for curiosity, if they know about radon, they were aware about radon before the enrollment on these studies. So here you can see the black dot are the patients enrolled in the different areas over the radon map in Spain. And 56% of the patients didn't know anything about radon before this before this study. The thing is that the majority of them, after knowing about radon, wants to know more and to have additional information. So this is something that is important. So it's not, sometimes they say, no, it's a patient with an advanced disease, it's not important for them. No, it's important. So they are interested on knowing more information. And what about the other patients? So the patient that we know radon, which is the main source of information, and it was the TV. I was surprised because, you know, in this, not the internet or not the social media, but this is our cohort of patients, you know, not limited by the age. And the median age of lung cancer is around 65, 70 years old. So it's normal that this population are still using TV compared with the young people. So this is just preliminary evidence. They will present more information in future meetings because it's still too early. So the thing is that for communicate radon, it's important to know that for patients with lung cancer, they have already cancer. So it's important to communicate with an adapted and tailored message because the cancer risk communication doesn't work. So we need to be focused on cancer care, which is indeed the priority. Is radon has been related with my tumor, and radon can be related with my evolution, like the evolution of my cancer. So, and there is one specific question about cancer risk, which is the risk in families. And this is something important to explore in future studies because it's, you know, they are co-exposed to radon during long time in the same way that the patients. So this is something important. So the patients in general appreciate that the doctors inform about radon, but with this tailored message. So in this context, we can think doctors are the good communicators for radon. This is true. No. I wonder, indeed, this is a questionnaire, so I was talking about Tanya yesterday. So this year I had the opportunity, I was invited to do an educational session in ASCO. ASCO is the most important congress in oncology around the world. It's the American Congress, but it's, you know, the most important. So it was the first time that radon will be included in the educational program, so I was really happy. And I was preparing the presentation, and like 10 days before the presentation, I realized I'm preparing a presentation for people that know about radon, or know about the germline activation of cancer-based position, but they don't know anything because they are mainly oncologists working on lung cancer or in other tumors. So what is the level of knowledge about this for these specialists? So I sent like an electronic survey, 12 questions, very simple, just to know what is the level of knowledge of the specialists in lung cancer about radon and the risk factors. So it was nice because we obtained 174 responses just in 10 days from specialists in lung cancer, the majority of them medical oncologists, but also pulmonologists, radiation oncologists, thoracic surgeons, and other specialists, mainly from research. And indeed, radon, it was one of the top 6 factors, the top risk factors associated with lung cancer. So obviously, it's smoking the first one. The second one between occupational factors, or the second hand smoking, and then the third was radon. It was also air pollution and other lung diseases. In the case of young population, because the presentation was about young population, it was radon become less important, probably because people associate radon with chronic exposure, which is true, but sometimes it depends on the exposure, so in the period, and also the predisposition, because there is another factors. But, you know, the people think more about family history, cancer genetics, when we talk about young people. Okay, something that was interesting about this mini study was to explore what is the awareness of vision. You know, but because in Europe, we are really different. We have different distribution of cancer and different distribution of risk factors. And when we analyzed this, we saw that Asia and Oceania, the awareness about radon was less important. Well, because in Asia, this is the most relevant risk factors in non-smokers is air pollution. No, they are more concerned about air pollution and less about radon. But we know that there is some kind of a specific strategy that we can work by area. Okay, so in general, doctors are aware about radon, but they don't have the knowledge to communicate radon. So this is something positive because we can train the people to explain and to being able to communicate about it. So how I do the communication, well, this is very simple, but just to keep in mind, so the first time, in the first consultation, I talk about radon. All the patients and the fellow or the students sometimes like, so we have a delay of 1 hour and a half, and you start talking about radon? Yes. So in the first consultation, always, independent, regardless the type of tumor, because this is something possible for the patients to understand the risk factors that can be related to smoking, to lung cancer. In a smoker, this is something possible because they are guilty. They feel guilty about the exposure to smoking. So when to smoking, smoke, and if they are exposed to other carcinogens, it's like, oh, okay, so it's not only smoking, and for non-smokers, this is something positive because they even understand what they have lung cancer. So we explain what is radon and the impact on health, then how to measure, because sometimes we say that is a risk factor, is a problem, and that's it. No, we need to explain what we can do to reduce the risk. So measure radon and take actions. And then this is from our lab. Participate in research. So we integrate the information in the medical history. So when we talk about radon, we include this in, so when the patient was born, or the place where the patient has been living, and all the information that you can imagine, also for environmental exposure, occupational exposure, family history. So first consultation is like this, and the all this data, risk factors is like this. But this is just the first consultation. If you are well trained, it takes 5 minutes. But it's but it's at the beginning. So this is my recommendation for my colleagues. The patients appreciate a lot in the first consultation to give time to discuss about the risk factors involved in lung cancer and beyond smoking. It's not only smoking. And the other thing that I mentioned before is important for them is the impact of the lung cancer care. And we don't know anything about this. We have very limited data and we need to generate this knowledge. Because usually oncologists start thinking with the diagnosis of the tumor. So we have the diagnosis, we prescribe a treatment, and we follow the patient and see the cancer evolution. But indeed, we don't know if the radon exposure can modulate the cancer evolution and modulate and can influence in the response to the therapies. So it seems like a sci-fi, but let me show you one example with smoking. So smoking is a prognostic factor. So the patient that continued smoking after the diagnosis of lung cancer is associated with high mortality. And in contrast, is the predictive factors of response. Smoking is associated with better response to immunotherapy. So we can use risk factors to see the impact on the outcomes of the patients or response to the therapies. But we don't know anything about radon and immunotherapies. So this is the objective of our company. Unfortunately, this knowledge in patients, and the majority of the patients, we have 4 or 5 patients that we didn't allow the participation in this project. The majority wants to be an active part of the research. Okay, so rapidly to talk about the impact. So this is how we see the patient without all the questions. So just non-smoker. So we collect medical data on the smoking habit. And this is after 5 minutes. So this is a patient enrolled by radon. So only asking about all the risk factors related to lifestyle, we define exposed to cannabis, also secondhand smoking, environmental history with radon from area, occupational history, family history of cancer, and we identify cancer predisposition and also exposure to all risk factors associated with smoking, with lung cancer and non-smoking. So impact for the patient, for the family, and also for the general population generated protection strategies. Another thing is we need to be aware of the risk factors for primary prevention, not only for the families, for patients, also for the families, for the patient, and still we don't know if there is any role for radon for this lung cancer. About cancer care, we have no data, but we will see value radon in the future, and we are funding with the lung cancer prevention campaigns. So this is 2 examples of campaigns to prevent cancer, and there is no mention about radon. So these are the measures that we can reduce cancer, and radon is not included. This is something that we need to work on. And the communication, we need to try to communicate and to teach about the process. 2 things in specific meetings for oncologists and other specialists, to gain this knowledge, and we have all this educational session and the track of scientific committees of all these congress. I push to enroll radon in these meetings. And for communication strategies for the patient, they need specific activities, and they need to take time to discuss. This is just 2 examples of this year that we do. I'm meeting with patient, question, and face-to-face meeting with a colleague, a patient, and people from the physics department of the University of Polytechnica Catalonia to talk about radon, in a 360 perspective. And just to conclude, communication about radon should be part of this doctor communication process, especially with lung cancer. We have this lack of knowledge of awareness about radon in patients, families, also in physicians, including lung cancer specialists. But for patients, they appreciate to know about these factors beyond tobacco smoke. They are more focused on cancer care and prevention for the family, and wants to participate in research. And in the future, there's strategies for cancer prevention care with communication strategies for professional patients and obviously multidisciplinary collaborations. So that's all. Thank you very much for your attention.
So now it's already the last speaker, Valeria, Gruber, the treatment or threat, challenges and strategies in radon communication in Austria.
Okay.
Yeah.
So thank you, Bea. I also, before I start, I want to take the chance to say thank you to the organizers. It was really a fantastic week. I really enjoyed it a lot. And thanks also to the speakers before, with all this interesting aspect of radon communication. And I will add one more very specific aspect. It's about radon spas and the communication or the communication controversy between radon protection and radon spas. And also in the Radon project, we heard a lot of the Radon project in the last weeks. There was also a specific task dedicated to risk perception in Radon spas, and I will also show some of the results and work which was done there, and also thanks to the Radon spa task team for the good work we did there. So just briefly, who are we? We are the National Radon Competence Center, and our goal and our mission is the radon protection of the Austrian population. So we are not the ones promoting the radon spas, and we are not in the payroll of the radon spas, but of course, it influences and affects our work in Austria with radon communication. So we are coordinating all activities relating radon in Austria. I will not go in detail. You will know maybe some of the people up there. We are 8. If we also count Wolfgang, who is also still interested in radon. Yeah, so we do all kind of radon work and radon communication in Austria. So to start with the legal basics in Austria. So for radon protection, in 1992, there was the first radon recommendation by the Austrian Radiation Protection Commission. And we had first reference levels and radon map, and the need for radon communication was already in there, but it took until 2004, I don't count it now how many years, till it was included in the Radiation Protection Act with a specific paragraph regarding radon and dwellings. And then, like all the other countries or member states, we had to implement the European Basic Safety Standards. We did this in 2020 with our new Radiation Protection Act and the specific radon protection ordinance. But on the other hand, already since the 1960s, so 30 years earlier than the first radon protection law, we have regional laws for radon for spas and spa areas, which regulates necessary minimum radon concentration for radon treatment. So this is that it's required. You have to have a radon concentration like this and this, so then you can be officially a radon spa. So for the radon spas, the ones who are not aware of this, so the radon treatment used is mainly for pain therapy, for chronic and rheumatic disorders of the musculoskeletal system, and it's a treatment, it's a medical treatment, and the prescription is necessary from a medical doctor. So I think there are different ways of this treatment. There's this path with the water, there's the tunnels with inhaling, and there's also this vaporization things. So maybe at the moment, vaping is very popular, so they also use this now for the radon therapy. This is our radon map, radon risk map in Austria, the delineation of the radon areas. And we have mainly 3 areas in Austria where we have the radon spas. They are quite touristic areas usually, and it's also an economic factor. Of course, there are also workplaces and combined with or related to this radon spas. So some more questions or some examples from how these radon spas are advertised. So I have, for example, here the official Gastein. This is one of these areas website, and if you go to Vitality, then you have the Gastein, they advertise Gastein thermal water and also radon therapy and time out in nature. So here you can see that it's really kind of wellness and well-being, and also here in the bottom, it's also an international advertisement about Austrian holidays, feel the glow under the mountain into radon spa in Austria. And also here, the second one, it's an economical newspaper, and it said something when they built a new radon spa, that this is now the new radon water is an attraction, and it's a new impulse for the region, and it saves or it gives another 90 full year workplaces. So it's also an economic factor. And the last one here is a newspaper for medical doctors, and here they also say that it's very promising perspectives if you have used this radon therapy. So this is the situation. So my talk today is more about radon communication, but my physicist and radon protection expert part needs to say something about also the dose monitoring in these radon spas. So for the patients, So they are allowed only to do this treatment with medical indication, and the other doctor has to do this benefit versus risk assessment. And so the dose for the patient usually is quite low, 2 millisievert, and this is a benefit risk assessment. But of course, we have to protect the workers there. So the radon spas are included in our legislation, and there are mandatory radon measurements and dose assessment necessary. And most of the employees, so the doctors and the therapists, are usually about below 6 millisievert. The radon concentrations in those areas are under control, and usually the areas are well ventilated. Some are permanently controlled, mainly the technicians, the one who do the treatment of the water in the basement usually, or they pour in the baths. So their measures are recommended, like increased ventilation or tightness of doors, or reduce the occupancy time. The problem where we have the most problems or concerns are the workers in the water supplies for the radon spas. So they can get their very high radon concentrations in there. When they clean the water storage basins, they really need to do a very well ventilation before they enter, otherwise they will really have very, very high doses. So for the radon, the goal of this radon spa task was the risk perception of radon spas. So investigate and address the potential controversy between radon as a treatment and radon as a threat, and with the focus on perception, representations, and enactments of radon in radon spas. And there were 3 parts of this with mixed methods. And the first one was, how is radon communicated on the websites of the radon spas, so the radon spas themselves. So a framing analysis was done there. Then the second was, how is radon in radon spas perceived by the general public? This was part of the behavioral atlas Daniel presented yesterday or the day before yesterday. And there were also some questions included about radon spas in Austria, Germany, and Czech Republic. And the third part is, how is radon perceived and enacted by the radon spa employees and the authorities in Austria and in Germany, and this was done by semi-structured interviews. So for the first time, for the first part, the framing analysis, so the goal was to identify the radon spas across Europe and to investigate how radon is presented and framed and communicated about on websites of radon spas. So about 25 radon spa websites were found and analyzed, and this framing analysis was done, and these frames highlight some aspects while downplaying or ignoring others. And the 5 frames which were found was the radon as a source of health, radon as a natural gas, radon as a risk or non-risk, radon as an affordable luxury, and radon as a source of use. So I'm not an expert in this study, so if you want to know more, there's a paper already out for this, and in case Daniel is here, if you have questions already now. So the second part was then the awareness, radon spa awareness of the population. So I said this is part of the European Radon Behavioral Atlas, which Daniel showed, and there it was done by computer-assisted web interviews, and as I said, radon spa and caves questions were included in Austria, Germany, and Czech Republic. And there I only have 2 examples taken out here. So it was like, do you know anything about radon spas or caves? And here where I put this circles, this is Austria, and the green one is yes, and the gray one is I heard something about radon, and this is here about 75% in Austria of the populations know that the radon spas exist. So it's quite a lot. And the second part is here, radon as it has healing powers. And even here, about 30% say yes, I agree, or I strongly agree. And only about 20% say they don't agree in this. So it seems, you see that radon spas are very well known, and it's in Austria, and also well received, or with a positive, mainly with a positive effect. So, but the other point is then the risk perception and the confidence in authorities. So we asked here how to perceive the potential risk to your health in the next 20 years from each of the following sources. There are different sources like environmental pollution, climate crisis, nuclear accidents, and there are also questions included about radon, two different ways. Tanya explained this yesterday, and we can see here that the risk perception of radon is not so high. So about 20–30% say it's very low, and only very few say it's very high. And here for the radon spas, this is even lower, so people are not really afraid of radon spas. And here we have the confidence in authorities, how the authorities will protect you from this risk. And here also we can see that for radon spas, this is very high. So the people are not really afraid of radon spas, and they trust that they are well protected. And here on our own behalf, I have to show this. They got in detail also here about these authorities and the trust. So it says here on the axis, on the x-axis, technically, are they technically competent, the different institutes, and here it says telling the truth, so are they trustable. And here in the very, very up corner, we have the Radon Competence Center of Austria is the most technically competent, and almost the most telling the truth one, only beaten by the scientists, which might also be us maybe. So from time to time, you should do some surveys, and then you can feel better with your work. So the third part were then the interviews with radon spa employees and authorities. So there were done 16 semi-structured interviews, 11 in Austria, 5 in Germany. And the first group was spa employees and management personnel. The second one were representatives from health authorities and radiation protection authorities and scientists. And some highlights here. So it was clearly in these interviews that the perception difference, there was a perception difference between spas with the de-radonized water as a place for leisure and wellness, and the real radon spa with tunnels or bars, which is the treatment. So this was clear for the authorities and for the employees there, which was not so clear when we see this in the advertisements, where more like advertised that radon treatment is a wellness thing. So for the first group, it was like they were asked, like, what do you know, or how much do you know about radon? And they had a little self-perceived knowledge about radon. They said they only know what to that extent that corresponds with their professional activities, but they don't think from themselves that they know a lot about radon. They often refer this group to radon as a natural gas, and it has healing powers and health benefits, and there really have a lot of success stories. So they do it like this, that they have already this success stories and testimonials. So what we should do maybe also more in the other way around. So there was a disagreement from the authority group and the spa employees about this perception, if there is scientific evidence or not, because there are some papers and studies about this, but the scientists and authorities more think this is not enough scientific evidence, while the others say, okay, there is already scientific evidence. For the justification, it was often quoted, Paracelsus quote with the dose make the poison, and also it's already a long period of time used already, so for healing powers, so cannot be that wrong. And as we saw also in the survey, it's perceived as a controllable risk, and they have and a safe feeling, because it has to be prescribed by doctors, and those measurements are done, and the occupancy time is limited. So within the radon norm, then addressing these controversies between radon as a treatment and radon as a treat, ended, or the result was to give some recommendation for communication strategies and activities. There was a milestone, and there will be a final report soon this autumn. And some of the points were that the existence of these two radon realities must not be a contradiction per se, but it's important to bring the different radon realities together. So the difference between those realities should be well and clearly communicated, and involve stakeholders such as doctors, general practitioners, and health authorities for radon protection. And the institutions working in both radon contexts should work together to give a holistic information on radon. So this is the situation we have in Austria. So we have these two realities. We always call it the good radon versus the bad radon. So, and now for the last slides, I want to show some of our activities, what we try to do to face this situation or this challenge. And this first slide here, we do a media analysis. We count and classify articles. And this is here the start from 2000, starting from 2012. And the light blue ones are articles about the blood radon, so mainly advertisements like this about the radon spas, and the red ones are articles about the bad radon, so means about radon protection, about the risk of radon. And we see that in the past, the blue ones are the ones about good radon were clearly higher, or at least as high as the ones about the bad radon, but then it went up. So this is from 2018. So this was clearly related for the new European basic safety standards and all the new regulations. So the interest and the communication went up, or the articles increased, number of articles increased a lot, and stays also stable quite high and much higher than the ones for the good radon. So we see this as a success, at least a bit. So what else do we do? So we try to involve, as we heard today, the doctors and the medical sector, because as you know, as I showed, we have these regulations for radon spas already since the 1960s. So a lot of doctors mainly know radon for this radon treatment and the positive health effect, and don't think so much about radon, or not at all at radon as a threat. So we started to go on conferences and trainings, participate in trainings with posters and presentations for the medical sector. We started a recently cooperation with relevant stakeholder associations, now with the Neurologists Association and the Occupational Physicians Association. We just prepared information material for the slum doctors and their patients. So we will send this out this autumn, and we will give a press conference for this together with a well-known pneumologist. He is also testimonial on our website now, so he's quite trusted and well-known because he's in the TV every time it's about lung cancer. This doctor is in the TV, so, and he is now also fighting with us for the radon protection. Another thing is we have our radon network. It's an exchange platform for all the ones working or are somehow affected by radon and radon protection. And we always have, we have an annual meeting. So these were pictures, photos from the last year. We always do an excursion. This was to a salt mine, so an underground workplace. And this year, with our meeting on the 7th of November, the Radon Day, we will go in one of these high radon risk areas and radon spa area in Tirol. So we go directly in the lions. Yes. So we will see if we survive. And we also invited a representative from the Radon Spa to give a presentation on our meeting about radon protection activities, and we also do an excursion in this Radon Spa. And we also started to have radon information events for the population in high-risk areas, and also there now in this Radon Spa area, we will have an information event in the evening before the network meeting for the general population. And last but not least, so for raising awareness in general, we have our radon website. We try to participate in non-radon specific events, so like Night of the Research, some safety events where we are with our booths next to the fire brigade and the policemen, so in between the radon, and we do cooperation with other stakeholders like the civil protection or cancer aid. We started this now. We have information materials, for example, this interactive radon house, so people can inform themselves about radon. So we put this in waiting areas or in authorities. So when people are bored, Well, because they have to wait for a long time, they even might be interested in radon. And we have our radon measurement campaigns for free 2 times a year, 1,000 measurements each for 1,000 households. And this helps a lot for the communication that we can offer when we discuss and talk to the people, that we can say, so you can also have a free radon measurement. So just to conclude and sum up, so the radon communication for good radon versus bad radon is challenging, and this existence of 2 realities needs to be clearly communicated. The medical sector is important stakeholder to provide information about health protection from radon because they're trusted and they are good multipliers. So the institutions working in both radon context should work together, and our goal is to provide information about radon, both realities, by us, the Radon Competence Center, together with the Radon Spas. We want to have a brochure and information campaigns planned, but we've planned this already for years, but maybe we will be more successful soon. And we did the first step. Last year, we did have an excursion. The radon radiation and radon experts went to the Radon Spa in the tunnel, and it was very interesting, but it was really challenging. And I did not think a single minute about the radon there because it was just 42 degrees and 100% of humidity, and it was challenging for us and also for the instruments. So, thank you.
Stay, and we'll ask the other speakers to come up here also, join us here.